There are several treatments available for patients with acromegaly. Primary treatment is surgery, transsphenoidal surgery, which is performed by a neurosurgeon who is experienced with this type of surgeries. There are situations when patients either do not qualify in terms of medical comorbidities to undergo surgery, or they do not have access to an expert neurosurgeon. For those patients, we can use medications first. There are two categories of medications approved in the United States for treatment of acromegaly. And then there is a third category of medications that is used off-label, so not specifically approved for growth hormone secreting tumors in the United States. So the main category of medications approved is called somatostatin receptor ligand. There are 4 different options in this group of medication. 3 of them are injectable options. They are usually given as once a month injections. And one, which was just approved last year in 2020, is an oral somatostatin receptor ligand. It's the same octreotide molecule that has been delivered injectable for many decades. Now it is available as a capsule. So we have 4 options in this category called somatostatin receptor ligands. We have 1 option in the category of growth hormone receptor antagonist, and this is called pegvisomant, and it's a daily subcutaneous injection. And finally, that category that is FDA approved for prolactinoma and not for growth hormone secreting tumor is called dopamine agonist. And in that category, we are mostly using cabergoline, either as an adjunct to somatostatin receptor ligands or on its own when the elevation of the IGF-1 is just mild. We're using cabergoline and not bromocriptine, which is the other available dopamine agonist, because bromocriptine is not very effective in treatment of acromegaly. And there is radiation as well that can be used in patients with growth hormone secreting tumors. We tend to use this after surgery and medical options were used, and we are still not in a place where the patient is in biochemical control, or maybe the patient cannot tolerate medications, or there is a discordant response with tumor not with the tumor growing despite a reasonable biochemical control. Those situations are rare, fortunately, and for these patients who are not in control after surgery and medical treatment, we employ radiation. We really want the patients to get to biochemical control. Radiation works slowly. It's not an immediate response of growth hormone and IGF-1 levels, and it's not a guarantee that the patient will come off the medicine if they undergo radiation. They might use fewer medicines, but it will take years, and some of them may be okay without medicines. Yes, these are the 3 options we have available: surgery, medical treatment, and radiation, typically used in this order.